I want to say welcome to everyone who's joining us this afternoon. My name is Tori Jennison. I am with the New Hampshire Public Health Association. Thanks for your patience as we navigated some technical gremlins, because that's how it always goes, right? So I want to welcome folks to the first Policy Pulse session for New Hampshire Public Health Association in 2025. Our goal today is to do a deeper dive into the current health policy issues that have an impact on complex environment and attitudes, programs, and practices in New Hampshire. So this webinar that you're joining us for today came about as a result of watchful kind of waiting and learning around the changes that the Trump administration was making to intensify immigration enforcement efforts that included deploying additional ICE officers, removing restrictions on enforcement in sensitive or protected locations, like courthouses and healthcare facilities. We're also aware that some New Hampshire law enforcement agencies have taken on some unprecedented work around supporting ICE's federal immigration enforcement roles via what's known as the 287G program. So we have seen some local New Hampshire law enforcement agencies do some federal immigration work, often with ICE oversight or partnership. So we're sensitive to the fact that these changes have contributed to some increased concerns about risk and fear in New Hampshire immigrant communities that have the potential to create delays in people seeking necessary medical care or avoiding it completely. We do have literature that tells us this increases risk for preterm births, which is a very big concern given the public health kind of minefield for maternal child health in New Hampshire, and for cardiovascular events specifically, and has significant potential for negative impact on mental health for children and families, where we see an increased prevalence of anxiety, depression, PTSD, and financial strain. So our goal here today is to offer healthcare and service providers and partners some operational guidance on how to navigate these complex situations while meeting your ethical and legal responsibilities. And we're grateful that we were supported to bring this to you by a grant from the American Public Health Association. So today we have a great duo to share their expertise with you. They'll introduce themselves as we move through the program. They'll each spend about 20 minutes talking to you about their area of expertise. Katherine Harake and Iraida Muñoz. And then we're going to spend some time talking to you, taking your questions, responding to your questions and comments and observations as we wrap up. Please make sure that you stay with us through the brief 3-question poll at the end of the session, so that we can get your feedback as we continue to develop these opportunities. We do have a couple of goals today. As I mentioned, we convened this discussion so that we could share essential situational awareness for you about the legal rights of individuals and responsibilities for providers and facilities during immigration enforcement action. We hope that participants in this session will find these practical recommendations and tools helpful as you support your staff and the people you serve and their families in navigating what's becoming an increasingly complex immigration landscape in New Hampshire. Our hope is that the information that we share helps you provide service with clarity, compassion, and confidence, in the hope that all people in New Hampshire, regardless of their immigration status, can access the care, the safety, and the dignity that they deserve. These are our 6 topical goals here that hopefully you'll walk away with some new skills and tools around. I do want to start us off with a level set about kind of the current situation in New Hampshire for it's kind of a population dry demographic. What are we really talking about? How big is this discussion? And the data that I'm showing you right now is drawn from a number of sources that are kind of correlated by the American Immigration Council, including the census, including the American Community Survey. But it's not news to anyone that accurate data is difficult to get for all the obvious reasons. Some of the less obvious reasons include a lack of consistency and clarity in terms and definitions across programs, and changes in support and operational directives from the federal government, including President Trump's executive order in January of this year that froze funds for refugee resettlement. So yeah, that has an impact, a direct impact on us in New Hampshire. Over 400 refugees were resettled in New Hampshire in 2023, more than 200 resettled in 2024. So the loss of that funding has an impact on how we understand the needs of these communities. So estimates suggest that about 15% of New Hampshire's immigrant population are in the United States without a legal status. It's 15% is not a small number. Nationally, slightly fewer than half are eligible voters. More than are likely to be working age and active in the labor force than their US born age mate counterparts. So the takeaway from that data is that this population offers the potential for bigger contributions to the economy as consumers and taxpayers, which help fund social services and programs. So this is part of setting the stage for why are we here? Why are we having this conversation? It's more than law enforcement security. We have community resilience kind of on the table here as well. In New Hampshire, our immigrant populations are split about 50-50 between genders. Almost 85% report being proficient in English, and almost 50% have a college or postgraduate degree. And New Hampshire does see higher graduate degrees than the national average. So in addition to some of these other variations, we know that in New Hampshire, we've got a pretty diverse immigrant population. And I know that our speakers will speak to that in more detail. So my last slide for you before we transition is just to provide a brief overview of the different types of immigration status, because not all statuses have the same challenges or receive the same benefits or experience the same risks. So there are, for the purposes of our discussion today, we've got 6 different categories of immigrant status: the U.S. citizen, which kind of speaks for itself. It also includes folks who get visas for shorter term specific purposes and times. Those can be tourist reasons, those can be student reasons, those can be work reasons, both skilled labor and seasonal and agricultural visas. So what we know about those is that a few thousand immigrants every year come to New Hampshire on temporary visas. Most of those are H-1B, which are the skilled work technology. There are a smaller percentage of those for H-2, which are agricultural or the seasonal work, like think ski resorts, the tourism industry. For many folks in any of these categories, the men go to work immediately, which increases the risk of isolation and disconnection for women and family members. And that's one of the reasons that while we can break out the different statuses, that's an administrative kind of categorization, but the health challenges are real for everyone. So lawful permanent resident, otherwise known as a green card holder, folks can live and work in the US permanently and they can apply for citizenship. There is a risk that they can be deported for certain legal violations, and what those legal violations are and how they are addressed has been shifting under the current administration. Hard to communicate about risk when it's not clear what it is and when it changes all the time. Um, so non-immigrant temporary status includes those folks that have visas. It's that short-term stay for a purpose. Refugee or asylee are those folks who are applying for this status because of fear of persecution or violence or harm in their home country. And you do have the option to apply for permanent residency after a year. In New Hampshire, folks from the immigrant is the appropriate term that we often hear folks referring to as illegal or the general bucket. People aren't illegal, right? Let's set that expectation. But they can have sub-satisfactory documentation for administrative purposes. And then there are folks who are in deferred action programs, and those are the things like DACA, and that's another category of immigration that is experiencing a lot of uncertainty and confusion right now. And it does not provide and does not lead to permanent status, even though there have been attempts over a number of years to get us to the point where it does. So these are really complicated categories for legal reasons, for what avenues folks have to pursue in order to stay in the US, what protections are available to them, what resources are available to them. That's a conversation for a different day. Today, we're going to talk about what the current immigration environment impact is on health for providers and for individuals in New Hampshire. And I'm going to turn the discussion over to do that to Katherine, and I'm going to stop sharing this and start sharing her slide deck as she introduces herself.
Thank you, Tori. Tori, I think I can go ahead and share the slide. If you want me to try
Great.
it, I can do it. Just one sec. If this works, let me know. Can everybody see the slide now?
Yes.
Can you see it?
I think we are. Yes. We still have
Okay.
that small. There we go. That looks good.
Okay, great. So, hello, everybody. Thank you for joining today. So, my name is Katherine Harake. I'm an organizer for the ACLU of New Hampshire. My pronouns are she, her. And I just want to start this presentation with a disclaimer, right? This is about immigration enforcement for healthcare centers, whether it's a clinic or a hospital or a private practice of any type. So just to let you know that I am not a lawyer. I am the regional campaign manager for Rockingham and Stratford County. That being said, even if I was a lawyer, we put up these disclaimers. As Tori explained, the immigration status is very complex. Everyone's story and how they come to the U.S. is different. So you cannot give a blanket answer for everybody. There's situations and nuances to each. So this is information based. And with this information, will hopefully help you to be in the right path to protect yourselves and your patients. So, again, to start with the why we're here, and I'm sure you're all here for the same reason. We understand that public health includes all the public. That includes our immigrant community who live, work, and go to our schools. The most important part when thinking about knowing your rights when you interact with any kind of law enforcement on premises is the concept of public versus non-public areas. This is very simple, yet it's not done enough. And there's some pictures here you can see about just putting a sign where private areas are, a lobby, waiting areas, and those places are usually open to the public. But you could have, for example, a check-in area that is right at the beginning, and then create interior waiting spaces after patients check in, and that could be a private area, for example, or put some physical barriers between security and the entrance, the check-in, and the waiting area. So these are little things you could do to demarcate public and private areas. This is also important to know when you interact with law enforcement, you'll know where to direct them, that try to keep them in the public areas of your space. Why is protocol important? Just like any practice, consistency is key. If you are informing your staff and security, everybody about a protocol, then the behavior is consistent every time, despite who is coming, whether it's a patient, a police officer, ICE, Homeland Security. So you have clear, consistent actions. And also, of course, it goes without saying, it helps you with your legal compliance and HIPAA and protection of patient information, and also is protecting immigrant rights. This is a wonderful policy statement that was given as an example that hospitals provide. I really, this is the longest slide I have because I really do think this is something everybody should use as a good example. I'm going to read it quickly because I think it's important to say. Sample policy statement. It's the policy of this healthcare facility to ensure that our patients and their families or caregivers are safe and protected when they use our facilities and services. This facility will take steps to the greatest extent possible under the law to protect our patients and their information. It's the policy of this facility not to allow agents or employees of U.S. Immigration and Customs Enforcement, ICE, or CBP to access our facilities, records, or information unless required to do so by law or a valid order. I'm going to explain more in detail. Come into your space and ask for anything just because they want to. It has to be legal, and there are different types of requests that have different legal requirements. And at the end of the day, you don't have to say anything if you're not sure. And I'm going to repeat that over and over. You hear this a lot. You have the right to remain silent. It's not a cliche. It's really true. The first part of a protocol is to break down who is in your space. That's usually a reception or security, is depending how large your space is. A designated liaison, that's going to be a designated contact person who will do all the interaction with law enforcement. Legal counsel, and the rest of your staff. So what's the role of reception? Always be polite and firm. You're trying to keep order and peace in the space. You politely say someone will be with shortly. If you've already separated your public and private spaces, just gently guide them to the public space. Ask for their identification. If that could include their names, who they're representing. It's not always clear from what they're wearing who they are representing, police or ICE or otherwise. So it's okay to ask who they're representing, if they have anything to show ID, for example, and just keep them there very shortly. As in the reception of security, the minimum you have to do is just tell them to wait. You don't have to ask for anything more depending on your size. Just ask them to wait, depending on your staffing. Maybe reception is the designated contact, the liaison, but just keep them in a public space. So if you have a separate person who's the liaison, that's when they will ask for any documents, ID, and credentials. You are polite, you keep them in that public space, and you ask them to please wait, and you will get back to them. And hopefully you'll have the ability to get in touch with the legal counsel. If not, it's my recommendation that you learn this information and you will do to the best of your ability respond to their requests. But let's say there is legal counsel, you really should have it. We're going to go with that example. Now, you do have to inform all the staff because it only takes one staff member to let them in, or one staff member to open the computer or open a file, and then everything you've worked on has been lost. So it's just, we've done this at schools, for example. Most schools in New Hampshire have a similar protocol, and everybody on staff knows their role. They know who the liaison is. So they know that the security reception is keeping the law enforcement in public areas, and they know that they have the right to remain silent. They are under no legal obligation to say anything or reveal anything or help law enforcement. You do not get in trouble for being quiet. It's not against the law. The attorney, legal counsel's job is to make sure these credentials are valid, if they are who they say they represent, to make sure that the documents are requiring the release of information, or if they need more to back up that request, and I'll go into that in more detail. Some requests, for example, by a judge, are more valid than just a administrative order, which is something written not by a judge asking for information. But I'll get back to that. Just to give you an example, right? This is legal counsel will be looking for. Let's say there is a warrant to enter the premises because they're looking for a specific person, or they're looking for specific information. That would be the case of a subpoena. You would need it to be signed by a judge, and the form would say judge. Here, there's an example with a judge's signature. It's very clear. A ICE warrant that's not signed by a judge is not binding. You are not required to reveal or report anybody based on something that's not signed by a judge. You do not have to let the law enforcement in without a warrant signed by a judge. They have to stay in the public space. So it's a bit more complicated when you're talking about healthcare facilities, because you're not only talking about what to do when law enforcement arrives and if they're looking for someone or if they want to come in, what do you physically do with them? Where do you put them? A big part of your job, and I know that's why people wanted to do this presentation, was about HIPAA obligations and protected health information. So, as you know, for HIPAA, you are protecting not the patient, but the patient's information. What that means is you can only give information that the patient has provided you under very specific exceptions. The first exception is a judicial court order, warrant, subpoena, or summons. Now, the court order is what I just showed you, that something is signed by a judge. It's not the same as a warrant. It has to be specific about the date, the place, and the person they're looking for, that court order, even if it's for information. They can't be fishing. They can't just ask you for the names of all of your Spanish-speaking patients or all of your patients who don't speak English as a first language, for example. That's called fishing, right? So the court order has to be very specific, the date, the place, and what they're asking for. And it must be signed by a judge. An administrative request is not signed by a judge. However, you would be required to give information if it is accompanied by a written statement. And that written statement has to be, again, very specific. What information they're looking for, why they are there, the date. And if they don't have that, you can ask them for that written statement, and they have to come back to you with it. For all of these, you are not required to give information immediately. If you're not sure of the validity of this request, you can get back to them. We recommend that you seek legal counsel to make sure that these are legitimate requests. And for the third one, evidence of a crime committed on premises, this is an example where you may be able to disclose personal health information if you believe in good faith that at that moment a crime has occurred on the premises of your facility and giving information would help the situation. It has to be in good faith. And just so you know, I think Tori mentioned this. If you, for example, are undocumented and you enter this country illegally, your presence in the United States is not illegal in and of itself, and that these are civil violations. That being said, you should also understand that the vulnerability of this community, there are barriers to them. If you do violate HIPAA regulations, right? You do violate it, and information is given, um, even if you didn't follow these exceptions. The immigrant community often faces barriers to have to react and to even litigate against you. And that makes them more vulnerable, and that's also what makes them a target. So if you really want to protect your community, you have to make it really clear that you have a protocol in place and that privacy of data and privacy of their information is really, really important. And at the end of the day, if you are unsure, don't give the information. Please don't give the don't give the information away. And also know that disclosing information without these exceptions, can be a problem for you and your staff. What we recommend for ethical best practice is that, personal health information may include their status. It's not required. It may include it if that status is revealed via other identifying documents. So we recommend that you try to avoid, asking them their status. It's not required information, and to not give any documents that would reveal their status. For the hospital directory, some hospitals, if you're a hospital yourself, hospital directory is optional, and you should give that option to all your patients if they do or do not want to be in that hospital directory. Just a note on that, there is something called the plain view doctrine. If law enforcement enters your premises and they see information laid out on your desk or on the computer screen that's in plain view, they can use that information even without a warrant. So as part of your best practice, try to keep your screens away from the public view and keep any documents laying around covered. And last but not least, really, we just remind you that you don't have to be confrontational. Just be polite yet firm. You never use force. You never lie. You follow your protocol. Try to follow legal advice. Get legal counsel. You're not in any rush to do anything. You don't have to respond to this law enforcement right away. You can make them wait, whether it's to enter your premises. You can make them wait if they want information, especially when it comes to personal health information. You do not have to give it to them on site. You can get back to them. It's not specific about if you have to get back to them that day or that week, but you do not have to give it to them at that moment, and they do not have to wait there for you to get it for them. And you always have the right, if you're not sure about the documents they're showing you, or if they are telling you who they are in good faith, because it can be confusing if police come and they say they're cooperating with ICE, that if you're not really sure if they are cooperating, if it's illegal cooperation, if they are fishing for information, if you're not sure, you do not have to disclose anything. So I hope this was just a little, you know, introduction to you of what your rights are. That if you have any, more specific questions, I'm happy to help you out. I can lead your specific questions to our legal department, and they can do their best to, answer your queries. But believe me, having a protocol, doing public and private spaces is a really great start to protecting your community. Thank you.
Thank you, Katherine. That was fantastic. I'm going to ask Iraida to share her experience as a health policy strategist with the city of Nashua, New Hampshire, and some professional experience as the equity officer for the city of Nashua as well.
Thank you. And thanks for the opportunity. I just want to be sure that everybody is seeing my screen properly. Is everybody seeing it? Yes,
We
perfect.
are seeing your notes, I think, Iraida.
You are.
Yeah.
Oh no, we practice. It was supposed to be great. How about now?
Perfect.
Awesome. Thank you. Well, first of all, thank you for the opportunity to have me speaking to your audience. My name is Iraida Muñoz, and I am the public health strategist for the Division of Public Health and Community Services here in the city of Nashua, New Hampshire. I am the former equity officer for the division. I was in that position for about 3 years until February, March of this year. So I'm going to share a little bit of it soon, but let me just explain a little bit about us and what do we do. Our mission and vision is to promote, protect, and preserve the health and well-being of the Greater Nashua Public Health Region through the leadership and community collaboration. And we really want to have an informed, safe, healthy, and resilient community where all people can thrive and prosper. So those are our values and vision and mission. We are an accredited health department, so the City of Nashua Division of Public Health and Community Services is the region's leading public health strategist and the first accredited health department in New Hampshire. And we provide a range of direct services and engage a variety of partners in initiatives to ensure the health and well-being of the community. So part of the job that I do is basically sitting down in boards and meet most of our partners and be part of their strategic planning to help collaboration and contribute as much as possible within our city and our region. But again, I wanted to open up myself and being a little bit vulnerable with all of you so you can see where I come from and we can develop the communication and the conversation there. So I born and was raised in Puerto Rico, in the beautiful island of Puerto Rico. So from, beautiful beaches and beautiful views and beautiful weather, right? And it's a 24/7 all year round weather, great weather, always over 80 degrees. It could be 100 degrees right now and all the time raining and beautiful, everything all the time. But we do, as a family, we're a family of four, so obviously we do have situations going on. So we were forced to seek health services for one of our family members. So we ended up having to migrate. So I consider myself an immigrant, although I am a US citizen. So from there, then I just needed to go and just ended in New England. So from that beautiful view, I just have this view, right? So these are actual pictures of 2010. The first picture that you see there, it is for you just a landscape of a little bit of snow, but those are actually my two kids when they first saw snow and they couldn't understand what that means. So they were stepping over the snow and playing a little bit about it and just enjoying themselves. The one in the bottom was my first view of the very snowstorm, and that's my new view under my from my apartment. And the one on the top is me, what to do with the snow over my car and how to clean it. I have no idea what to do with it or how to clean it. No one teach me, no one help me. So my husband and I, we just needed to like figure it out. I guess the first time we did it was with, I don't know, with our own hands and arms, and we just moved stuff around. And in the center is me and my son. I was homeschooling a little bit and teaching them how to properly pronunciate some words in English. So a little bit of diversity index. So U.S. Census information here by 2020, the United States reflects 61.1% of diversity. Like different countries, I mean, different states have different percentages, but obviously we are in New England, so we're gonna focus on New Hampshire, 23.6% of the population. We have a combination of cultures here, right? So it's not only Spanish speakers, we have a bunch of Portuguese speakers, we have different kinds of cultures and refugees and beautiful combination of them. So with that in mind, through the years, myself, I needed to learn. I needed to learn how to merge, how to understand the system. So I took a year and a half, trying to understand how the culture works. And so some stories from my previous years involve just, of course, the cultural shock, right? So understanding how the services were provided um, was a big thing for me, right? When I arrived as a family, I needed to learn how to understand the culture, but also the language, right? And how can I teach my kids and my husband and my family overall how to how to manage the language. But as I was learning for myself, but also for others. So I was able to find employment and doing what I was doing for us, but sharing it with others. So I was able to serve others with the same things that I was helping our family with. So I work with refugees and immigrants and Spanish speakers, trying to set up their own um, needs, right? So I was able to work for the TANF program under Southern New Hampshire Services for a little bit, and I saw several domestic violence stories, several situations related to mental health, substance use disorder, traumas, and I was able to provide some employment training. I saw several situations related to lack of insurance, housing, childcare, transportation, et cetera, et cetera. So all these ones are related to social determinants of health. So we all know those are barriers um, for some of the people that we serve in hospital settings and in our field, but they are also real barriers for immigrants and refugees in our area. Fast forward working here with public health department. Just this morning, we get calls about just a girl that failed her hearing test and needed some help. Um, but her family is a Spanish speaker and she needed assistance. So parents were unable to communicate, so they called public health. So we are here to help with that. Um, 9-year-old girl with a tooth pain overseen by teachers. So that's very common. Like parents are unable to advocate. So they are, in need of that assistance. Mom with 2 kids with autism with a high level of that. So mom with a 9-year-old struggling with depression. So those are just some of the stories that we see here working at public health. So some of the moving forward, some of the key federal and New Hampshire policies that are threatening immigrant health are a few, right? So we are talking about limited access to federal health programs and local law enforcement engagement in immigration, barriers to access, and we all see, the lack of health insurance, language barriers, transportation and work schedules, misinformation and confusion. Those are those are barriers that we know they exist in most of the states, but we see and work with them all the time here in public health. And when we see that, we oftentimes jump and help out. We have community health workers here at the public health department. We help with advocacy. we work through the situation with them. But the limited access to federal health programs has been one of the situations that, especially public health, has been working on for the longest time, and we continue doing so. So right now, on some of the conversations that I have had with clinicians and other public health workers, we are really concerned about the future of federal funds. So that is one of our main concerns right now. We all know that some bills have been going on, and I have been able to be part of some of them, taking action, active action, and just visiting the courthouse. So one of them was House Bill 392 that was killed. Thankfully, that happened in February, and in March 6th, it was killed. But yeah, so that was a great experience. We as public health workers, we were there. I was able to do my testimony over there. I opened myself and was very vulnerable, as I am doing here today as well. And I exposed everything under as a public health equity officer, because as an equity officer, it was my duty to call all these situations happening and expose some of the implications that we were going to have. So coordinating language access was going to be one of the things that we were about to lose. Supporting culturally appropriate services, bridging gaps in care for limited English proficient communities. So their absence was going to be catastrophic. So we just did the job and we went there. What could have been some effects? The loss of housing, unemployment, and healthcare access, the increased stress and anxiety and mental health issues, obviously, the interrupted preventive care and management of chronic diseases. And we all know that immigrants may also experience isolation from systems that should support them, especially during crisis. So we know that immigrants and people struggling with this type of situations, especially on those circumstances, don't have the opportunity to speak to professionals, especially because of their special circumstances. So that's why they are in a vulnerable category, because the access of care is just not as easy, right? But when we talk about some of those bills that are out there, and we all know what happened with Medicaid at this point, right? So we know about the budgets and all the cuts. There's something that we have been speaking lately, and I have been able to discuss with some of the coworkers and people in our field, is about how to apply and the eligibility situation, right? So when people needs to apply or reapply, recertify for Medicaid, it is just very difficult, right? We all know that. We know that it's just you have to justify your existence every time you have to reapply. If you are already getting benefits, state benefits, and on top of that, you have to reapply every 6 months, as is the intention to continue doing. You have to submit paperwork after paperwork after paperwork. And then now, my understanding is that you have a 90-day waiting time. And when I speak with some folks that still work at the state level, they all admit, the lack of workforce is one of the big deals, right? So not having the right amount of people working with these folks, with this paperwork, these amounts of paperwork it's just hard, right? And when I'm saying this, I'm not saying it because I heard about it. I've seen it. I lived it, right? I worked next to them. And it's my understanding that each of those eligibility workers have over 1,000 cases that they have to see and reevaluate ongoing. That's inhumane. That is impossible. We have been talking about it for the longest time ever. This is not new. This is not a change. This has been happening, right? And with the changes that we have been seeing, we just expect that people is just gonna be unable to recertify and keep their services. So, so we partner, as I explained before. This is just one of the examples of our partners. We partnered with Greater Nashua Mental Health Center, and we went to the courthouse. And this is when we testify against that bill, when we were in favor of keeping the Office of Health Equity. And this is the group of the Office of Deaf and Hard of Hearing and the Nashua Division of Public Health and Community Services at the courthouse in February 2025. So very proud to say that I was able to do that as an equity officer. And after that, what was the implications? Well, we all know what happened. After that, DEI was dissolved, and those were the consequences of advocating for what you know is correct. But what it is a fact for me is, as we have been saying, no one is illegal, right? And not that all the immigrants are illegal here, right? And I'm gonna repeat that. There's no illegal people, and not everybody is illegal here, and not all the immigrants are illegal here. There's a very small portion of people that are here undocumented, and the vast majority of people is legally here. Some ethnic groups feel targeted, but all of them will feel the impact of federal cuts. And all of us will feel it. All of us will feel it in the end. I do feel that when I speak from the bottom of my heart, and when I say that there is a huge difference in between someone that is illegally here, and the ones that really have 2, 3, 4 jobs so you can have your food, so you can have all the needs covered. And they are your neighbors, and they are everyday's people that you say hi and bye, and they are part of our community. That should mean something. It should mean something to us. And I truly believe that at least the people that lives around me in our region, they are truly good people, and they are capable to see that. So um, I'm hoping that this will just help some folks understand that there is still good people there, and there's some sense out there, and that some folks can do the right thing this time. And thank you for the opportunity to talk.
Thank you, Iraida. So I invite folks, if you have questions or comments or observations, to share them in the Q&A space here on the webinar. I do want to kick us off with a question for both of you, but first for Katherine. You mentioned it was really helpful to hear that you encourage us to really emphasize a separation between our private space and our not private, or our public space and our non-public spaces. Maybe private isn't quite the right word, but public and non-public spaces, defining them and clearly, kind of making that demarcation visible is a priority that folks should focus on, and ensuring that everyone in the organization, in the building, knows what the protocol is. Have a protocol and make sure everybody knows it. Can you share any of your experiences or observations where you saw particularly effective methods of sharing that information, those protocols with folks? Because it can be really tough with workforce turnover, and were people posting it in certain places? Did they do drills? Did they do breakfast? Did they do text messages? Did they tape Post-it notes to people's monitors or foreheads? Or can you share any kind of really effective or promising approaches that you think are really good ways to do that?
Yeah, good question. Well, I will give you a restaurant example. I gave a Know Your Rights presentation to a restaurant and talked about public and non-public spaces that you could even put in your parking lot, customers only. For example, and then I actually went to a restaurant that was, they had heard about this Know Your Rights, and like messages kind of got spread in the community. And I went to a restaurant I'd been before. They had a sign on their door they didn't have before saying customers only on the front door. I went in and they had a bar that you go into the cashier register to make your order. You don't just go and sit down on the tables. And they played the music a little bit louder than normal. So it wasn't so easy to go in and start talking to people and ask questions. I saw these little nuance changes. And then for people who, just to kind of super simplify it, I use the analogy of vampires and saying a vampire can only come in your house and if you let them in. So it's the same thing with law enforcement. You have to let them in. You want to let the vampires in. It's that simple. They need permission. So and that permission looks like a warrant signed by a judge. And so I've seen physical examples and also using that analogy, just kind of getting that message across. And also for places that have a lot of staff, people don't want that responsibility. So it does actually ease that burden of responsibility to tell them, hey, you don't have to say anything. And you don't get in trouble for saying anything either. No one gets arrested for being silent. It's better to not give information than to give the wrong information or to violate HIPAA rules, right? So that actually having protocol and designating people's roles really creates a relief for everybody. And that's the message you have to give to staff.
Thank you. That's really good kind of refocus. I think, Iraida, can you speak to kind of your sense and your experience in Nashua about what do you wish community partners would know or do in order to support the folks that you are working with?
Thank you. Here in Nashua, we are a very close group of partners. So we like to work together as partners, but unfortunately, some of us, we are not like as partners, we are not educated properly. So here at Public Health, we took the opportunity and the challenge to educate partners. So we are in that journey of educating. So what I really want to see is people in organizations, for profits, non-profits, all together trying to learn what to do. Because in the beginning of the year, Katherine, no one wanted to talk about this. It was really something that no one really wanted to be talked about it. And it was almost prohibited. So it took us a little bit to normalize the conversation. And now we're just starting talking about it, but I'm afraid that we're not at the level that we are normalizing the conversation yet. So it's still some people feel guilty about it. So we're still in that level of fear. Some folks are not immigrants or refugees, but they are they don't want that responsibility. They don't want to be part of it. So I want more education for partners, businesses, hospitals, everybody in the private and public sector to be trained on what to do in case of these unfortunate circumstances.
Thank you. So, and I'll look to the Q&A or to the chat, and I invite folks again to share any information, any that you have, any thoughts or curiosities. I'm also going to ask our communications team to share the poll with folks that have stayed with us so that you can give us some feedback and just let folks know that we will be sending out a list of resources that we're compiling for you to use your own organization or your own kind of personal navigation by the end of the week. So today's Thursday. It'll come out to you by tomorrow for everyone that's registered here. This session will be available to us to show for free and make available for folks that want to watch it later. And so I see an interesting comment in the Q&A section from Kim Bernard saying that ICE doesn't always respect the request for warrants in a public space. And so that's a really good point. And Katherine, do you have any kind of feedback or advice around what happens when law enforcement is really aggressive in ways that, normally as service and healthcare providers, we have a collegial relationship with our law enforcement providers, not an antagonistic one. And they're not usually the folks that we practice de-escalation with. And I would encourage folks to kind of role play and practice this because it's a very real risk. And Katherine, do you have other suggestions for kind of how to vaccinate staff and teams against that risk of kind of conflict and confrontation?
True. I think the first thing is to be aware that they are persuasive and it can even come across as deceptive at times if they're plainclothes, for example. So that's right. I will stress again, they got healthcare guidance is recommending to create an interior waiting area after check-in so that that then becomes a private area. So if that's possible, so, create an interior waiting area after they check in and they can wait behind a wall or in another room than an open space. That's the best, advice I can give for if that is possible. And maybe make a sign saying private only, staff only. Again, it can't 100% protect you, but it
Have you ever seen an organization call, law enforcement for their own municipality to respond because in essence, if they don't have a right to be there and
Mhm.
they're trying to access a space that is not, permitted, then if they were not ICE, they would be, asked to leave by law enforcement. Is that something you've ever seen?
Well, I'm not a lawyer, but I do think our lawyers love it when immigration makes mistakes like that.
Okay.
Because when they make mistakes and go into a private space without a judicial warrant, that makes them vulnerable. So that's actually a really good point, Tori and Kim. If you believe there's a violation of your rights, if you believe that they went into a space they should not have, or they did not produce the information they needed to, you share that information with the ACLU of New Hampshire, share that with your lawyer, share that with, I assume, with Tori, and that's how we collect the data we know to find out what's happening and hopefully uh, shift the needle of power a little bit in our direction and not theirs.
Thanks, Kim, for that observation. We'll share some resources that may help folks kind of prepare or raise awareness for that eventuality. And I also want to share a very important reminder from Dr. Trinitellez that we can't tell what someone's legal status is by how they look, how they sound, whether they have an accent, whether they're speaking in another language, what their job is, where they live. Those are not things you can tell. So please keep in mind that we as public health kind of advocates, our our goal is to protect individuals and help keep them safe and well, and to do the same for populations. And we can do that by best practices for the most vulnerable, protect everyone. So I do want to thank our presenters today. Fantastic information. We'll share resources about how to follow up with them and get additional information with everyone who participated by the end of the day tomorrow, and look forward to helping this conversation move forward in all the places that it should be so that we can keep doing this great work. Thanks everyone for joining us. Have a wonderful rest of your day.
Thank you for having us.
Thank you.